Hello and welcome. Thank you so much for taking the time to visit with me live today. My name is Bryana Burken, pharmacist and physician liaison with Physicians Preference Pharmacy. And today we're going to discuss one of our regimens that we really offer to most of our guests that interact with us at Physicians Preference Pharmacy. And so I'm excited to unpack this because I often talk about my role as a physician liaison and what that means to help physicians build up their practice. And what I often notice is that this is a piece that probably too frequently actually gets missed. So we do get a lot of questions from the guest side about the Candida overgrowth, the yeast-free eating program, and so I think it deserves some attention as we discuss it today. So that's why I wanted to bring this one up for this webinar. So as usual, I do have some slides prepared for us. I'm going to go ahead and share those, and I've put a note in here that if you do have any questions, please be sure to drop those in either the Q&A or the comments in the chat box, and I'll go ahead and address those at the very end. All right, so let's go ahead and get started. So today we're going to be talking about Candida overgrowth. And Candida, if this is not something that you're familiar with and you're just used to the term yeast, then I'm going to help you understand exactly what the connection here that there is, because Candida is a type of yeast. But really what we're going to unpack is the difference between just like a bacteria naturally living in your body, what happens when a fungus naturally lives in your body, but what happens when it takes over. And that's really when the problem ensues. So that's why we incorporate this into all of our guests' health regimens to help them respond better to hormone therapy and to other auxiliary therapies that we offer. So today we're going to talk about Candida overgrowth, the link between yeast, cravings, which are probably sugar cravings, you've guessed, and gut symptoms, which if you're here and you are on a functional medicine approach with your physician, you've probably had some gut symptoms in the past. So as always, I do like to start out with a brief bit of information about our pharmacy, especially if you have never filled prescriptions with us before. Many of you have that are here, but I think it's still important to understand because we are a closed door pharmacy for the most part. You can't actually see what's going on behind closed doors, and there's a lot that goes on back there. So we are a compounding only pharmacy, meaning that most every single thing that we make is made right there on site in one of our two laboratories. Now, we do sell a few commercially available products, excuse me, and actually, we do have one commercially available product that is incorporated into this regimen, but I'm not going to spend too much time on it because I'm here to really discuss the compounds. But we are a non-sterile compounding facility, which just means that we don't make any IVs, we don't make any ophthalmics, which are anything that goes into the eye, and we don't make any injectables as well. Now, of course, we do specialize in BHRT, which is the bioidentical hormone replacement therapy, and the yeast-free eating program that we're going to discuss actually supports BHRT. So they do go hand in hand, which is why we recommend it on the front end of anyone that is going to be utilizing hormone therapy to first clean up the gut. As always, we like to emphasize, especially in one of the compounds called nystatin that I'm going to be discussing today, we want to be sure that our preparations are always free of any unnecessary binders, fillers, lactose, that stuff that you just don't need in the preparation. But not only that can actually inhibit the success of the therapy, and that's not always disclosed in the commercially available products, which is why it's important to us to go ahead and uncover that. Additionally, you may not be tuning in from Texas. You might be in one of the other states throughout the US. And so you know that we do ship to several other states. So we hold 49 licenses currently. That does exclude the state of Alabama, which we still have guests in Alabama. It just means we can't ship directly into that state specifically. And then also, because many people don't know that we actually work with physicians outside of the Hotze Health and Wellness Center, which is attached to Physicians Preference Pharmacy. We do work with physicians all over the country, so we're happy to serve them and to help to actually talk to them about these therapies that we have developed as well. And then lastly, we do still hold PCAB accreditation. So PCAB is the Pharmacy Compounding Accreditation Board. And when a pharmacy seeks accreditation through PCAB, what that means is that they are making and taking an oath to stick to stricter standards. So as a 503A pharmacy, which is what we are at Physicians Preference Pharmacy, we are regulated by the state boards of pharmacy. So in our case, we have to answer to 49 different state boards of pharmacy, whereas other pharmacies are specifically regulated by the FDA. So that's one of the main differences. But in addition to that, the standards that state boards put in have obviously their own set of rules. But when we seek out and we receive that continual PCAB accreditation, what that means is that those standards that we have the oath to stick to are even more strict than that. So basically, what that boils down to is you are getting in your bottle what your doctor says you're getting and what we say we're dispensing, essentially. All right. So let's talk about what it looks like for you or maybe someone you know to show up to the doctor with a set of symptoms that would maybe lead to prescriptions that are consistent with the yeast-free eating program. We know that we have a big problem here. And like I said at the beginning, I step foot into a lot of offices that are not even, the doctors are not even having this conversation with their patients. So it's important, I think, for me to talk to the physicians about it, and then also for me to talk to the guests about it, which is what happens with these webinars. I do them a week apart. So I deliver this information to the physicians last week and then this week to the guests so that we're all on the same page about what we're trying to address here. So we're seeing that more and more people are presenting to their physicians with symptoms that are congruent, usually with gut issues and gut discomfort, but specifically, those are manifesting into symptoms that might warrant or end in prescription drug therapies. So, we're talking about showing up with more anxiety, more depression. This is very common. And then the GI related symptoms. So belching, bloating, gas, abdominal discomfort, very common. Sugar cravings. This is a big one that, especially on new guest visits with folks, I tell them, hey, listen, the sugar cravings, those are not your fault. Yes, we all have different types and waves that we go through. We crave sugar. Some of that can actually be related to hormones as well and hormone fluctuation. But oftentimes the overgrowth of yeast within the gut and within the body can actually perpetuate those sugar cravings. So maybe it's not so much your body that's craving the sugar as it is the yeast inside your body that's craving the sugar. So when we think about it that way, and we think about how we can starve that yeast that's craving that sugar, we can actually address those sugar cravings. So it makes sense when you think about it like that. Indigestion, food allergies is another big one. So I could probably do a whole separate webinar on leaky gut, but we do talk about the implications of leaky gut or just when the gut barrier is not functioning healthily or not functioning well or optimally. And what that means is that your GI tract or your stomach that empties into your small and large intestines have a very specific purpose, many purposes, but one of those purposes is to keep the nutrients in and the toxins out. But when the body undergoes stress, environmental toxins, foods that are toxic or inflammatory, then it tends to weaken that gut lining. And so it compromises that gut lining. And then what happens is that we get some exchange of the nutrients and the toxins from the GI tract and the bloodstream. And that largely is how food allergies or food sensitivities can show up, which is why we offer auxiliary treatments like low dose immunotherapy in our allergy department that helps to correct the body's quote unquote inappropriate response to things it really shouldn't be responding negatively to while we simultaneously heal the gut so that the money and the time and the effort that you're spending on hormone therapy and other things, your body's actually receptive to it. So let's not forget to address all the pieces because we don't just want to address one system. Your body will never fully respond the way that we want it to if we're not addressing all the symptoms. It's not to overcomplicate it, it's to help you understand that we need to be working simultaneously on different systems so that you're really getting the most bang for your buck, honestly. So when we address the gut, we can actually help to alleviate or reverse or resolve some of those food allergies or sensitivities. Same thing would go for chemical sensitivities as well. A lot of times people will say, well, I just have these hives or I have these rashes that I cannot seem to get rid of. I can't understand why they come up. It's not like contact dermatitis or something that they ate necessarily. Oftentimes, when there is something in the gut that is taking over, the gut is one of the first line regulators of your immune response. So when symptoms show up topically on the skin, and it's not because you've come in contact with something that specifically damaged the skin, or like a bee sting, or you were scratched, or whatever that might be, a bite maybe, we can usually understand that that is coming from something on the inside. And so we need to again address the root cause of what's going on there. So people showing up with those skin rashes, brain fog is a really big one. Thrush. Thrush is a fairly common term that actually is usually related to Candida overgrowth. Usually we hear about that in terms of oral thrush. When you open your mouth, or you kind of examine your tongue and you see that white film or that white fuzzy look. That is a good indication that something from the GI tract or the stomach up is causing that Candida overgrowth, because Candida lives pretty much everywhere. It's naturally present on the skin and other systems as well, I'm going to show in just a moment. But additionally, and probably most profoundly, weight gain or stubborn weight loss can be a really important indicator that we have yeast overgrowth in the gut and the body. All right, so think about 4 years ago, I did deliver a version of this talk to a group of dental professionals. And I decided to keep this in here because I think it helps us to understand that, again, we're not just addressing one symptom or one system as we're trying to address symptoms. So, what I mean is that for us to understand how we can address gut health, how we can address Candida overgrowth, and approach it in a successful way, we have to really reframe our approach to gut health and our understanding. So there's many elements to this. It's a very complex system. But to simplify it, let's remember that health actually starts in the mouth. So that is part of our root cause approach. There is unfortunately quite a divide between the dental profession and medical doctors, but that bridge is being built. If you find the right biological dentists that know how to speak with functional medicine physicians, they do know how to both screen for root cause issues. But in your general checkup or exam, you're probably not going to be getting that attention for the most part. So, some of the root causes, as we talk about them starting in the mouth or the oral cavity, would be most commonly and obviously foods, right? So, anything that is a food that is high in yeast. So, why do we put yeast in foods? We bake them usually to help them rise. The most common one would be like a bread or something like that. So, think about those foods that when you bake them, they rise. Gluten and yeast aren't necessarily the same, and they're not one in one, but they foods that contain both of those oftentimes will overlap. So if you have a good sense of foods that contain gluten, you can think, okay, a lot of those foods also probably contain yeast. So we just want to be cognizant of how many of those are going in. And most importantly, that it's not disrupting the balance. Because again, yeast doesn't have to be bad, nor does bacteria. It just has to live commensally in the gut so that everybody's getting along. And when people, not people, but when these bugs, essentially the fungi and the bacteria, they don't get along, one overpowers the other, that's when we start having problems. So we have to be cognizant of the foods that are going in, which we're going to unpack that. And if you've been through the yeast-free eating program, like the name indicates, you know you have to adjust the foods that are going in for a limited amount of time. It's a form of an elimination diet. Also, oral hygiene products. So again, I come back to the fact that everything has to be in balance. So if we are killing off all the good guys, like all the good bacteria, all the good fungi throughout the body that is supposed to keep the system in balance, then what is going to happen is that when we kill off the good guys, the bad guys are going to overgrow. So, something that I don't think is probably talked about often enough is the use of mouthwashes specifically. So, mouthwashes are intended to kill off or knock down some of the bacteria and the other growths that can happen in the mouth. Yes, important, but at the same time, whatever you're using to brush your teeth, to use the mouthwash, or any other products that you're using inside the mouth to wipe out what's going on in there, you actually are therefore impacting the first step of digestion. The first step of digestion is when food, or really anything, including water, gum touches your mouth. That sends a signal to the brain to say, okay, we're ready to eat, we're ready to digest. Your body and your mouth starts to use those salivary enzymes to start breaking down whatever has just hit your tongue. So that is the first step of digestion. When the mouth and the body starts getting confused about what is going in it, then those systems get activated and things can really get out of balance. So again, if that first step of digestion is being impacted in a negative way, meaning that we are wiping out the good bacteria that are present in the mouth, it can actually lead to fungal overgrowth in the mouth because now that is what we call an opportunistic infection, meaning that something else that naturally lives there found an opportunity to create an opportunistic infection, meaning it now has the opportunity to create an infection because something else isn't stopping it from overgrowing anymore. So, again, oral hygiene products, something to take a good inventory of in your home. What are you and your family using? Stress. Stress is, it's almost laughable that we try and think that we can control it because I would probably say most of the stressors in our life are not necessarily controllable stressors. Work, home life, children, marriage, family. There's a lot of things that we don't necessarily choose or that we are surrounded by every single day that we can't necessarily control. You know the stressors that you can control. So those are the ones that you need to be focusing on. And actually, one of the stressors can be foods. So if you are consuming foods that are highly inflammatory, that is stressful to your body. Therefore, we classify it as a stressor. So you can control those stressors. Stress causes an inflammatory response in the body and it causes chemical releases within the body. So just to illustrate the long-term implications of this, think of someone who's been through a lot of trauma, like you yourself or someone that you know. We all know someone who's been through a lot of trauma. Decades down the line, there's usually something else that's still lingering for them. Their inability to really manage stress and be stress resilient. We see that a lot. What are the long-term implications of that? It's years and years, sometimes decades of consistent reactionary responses of the body trying to compensate for the effects of that stress. So it's constant inflammation, which we consider to be chronic inflammation, which does what? That chronic inflammation starts to break down the systems, and the gut would be one of those systems. So that's why we want to be sure that we can either do things temporarily to help mitigate the stress and or simultaneously remove ourselves physically from the stressors, whether that's people or environment. Again, we can't control it all, but we can control some. Dental hygiene routine, and then an evaluation of environment, which I have toxins here because toxins that we either are exposed to by breathing, eating, drinking. We do talk about microplastics that can be present in the water, um, certain chemicals that may make it into the water supply. So having a good water filtration system is important. And then, just depending on where you live, again, not 100% controllable. You might live in a large city with a lot of smog. You might live in the country, but be on a farm and be exposed to a lot of chemicals. So you can't always control all of that necessarily. However, you do need to be sure that you're doing things to mitigate that or to detoxify anything that you're being exposed to. So none of this has to do with prescription drugs. This has to do with addressing the root cause. So here I have basically a simplified 3-step process. It's address the root cause, deplete the gut, and then replete the gut. So when we deplete the gut, we're then talking about what we're here to talk about today, which is the yeast-free elimination. So I'm going to unpack some of the information about the compounded prescriptions and then also antifungals. So the dietary portion and then the antifungal medications that we use to help perpetuate that because it can't be done with just food alone. Helping to address yeast-free foods and keep more yeast-free foods in the diet will help to not allow so much of it to overgrow in the future. But again, this is why we have our guests do this yeast-free eating program about once a year, because there are so many things that are not controllable for us and we need to perpetuate that yeast die-off and clearance of the yeast from the body. And then lastly, part of the repletion phase is integrating both prebiotics and probiotics. And this is not an extensive list. There's so much more that we offer, and there's so much more that you can do to replete the gut and to keep it continually nourished. But these are just two that we have time to and can discuss about incorporating as we replete the gut as well. So, health starts in the mouth, but remember that it does, of course, manifest in the gut. Okay. So I've set the stage for how we're going to address the yeast overgrowth, but I still need to define it. So what exactly is candidiasis? It is the yeast overgrowth. It can be that opportunistic infection. So what you actually have in your body and on your body is candida. Candida albicans is this guy that you see over here on the slide, and this is what we normally see living on the skin, in the mouth, throat, gut, and the vaginal tract. Usually in the vaginal tract is where we hear about that yeast overgrowth. So sometimes, especially men, will get confused about that terminology. We are just talking about a yeast that lives all over and all within your body. It's only a yeast infection, quote, yeast infection or yeast overgrowth, again, when that opportunistic infection has occurred, which is what we're talking about. So, in excess, it can lead to systemic overgrowth, which means it's not just localized in the gut, it is actually throughout the system, including in the bloodstream. And that's what we call candidiasis. So, Candida overgrowth, candidiasis, that's overgrowth of Candida albicans, basically too much Candida. So, that can cause major problems, which can be frequently, so hear me when I say this, it can be frequently misdiagnosed. And this is why I think it's commonly getting missed in a lot of physicians' offices, is because they say, well, this person came in with anxiety and depression. Let's give them an anti anxiety med or an antidepressant. Doesn't necessarily help. What does it do? It causes more symptoms, which can lead to further prescription drug prescribing, right? So we want to stay away from that if we can. So we want to stay away also from that misdiagnosis of something else that would lead to the prescribing of unhelpful medications that could just mask the problem. So that's that band-aid approach that we talk about a lot. Now, the gut, as I alluded to, can become recurrently affected by Candida albicans, which is why we usually recommend that our guests go through this about once a year. So, as part of the root cause approach as well, on that slide where I was talking about taking inventory of the root cause, deplete, and then replete, part of that is also taking an evaluation of things that may be disturbing the mouth and the gut environments. We talked about stress, inflammation. Diet is a big one. And so we go deeper into the diet as far as what we need to eliminate during this yeast free eating program. But in general, if we're talking about the standard diet in the United States, we oftentimes will refer to that as the MAD diet or the SAD diet. That's the modern American diet or the standard American diet. And what is that? It's high in carbohydrates, it's low in protein, low in healthy fats, usually, and it's high in processed foods. We know all that. Usually high in sodiums because a lot of that food is coming off the shelf, if you even want to call it food. Also, taking things that kill off the intended protective oral microbiome. What we usually think about when we think about that are antibiotics. And on the flip side of that, what I would say is the overuse of steroids. So, steroids or high estrogen products, if it's the doses too high, can cause yeast overgrowth. Also, I would put certain birth controls into this category. Not all, because all birth controls are different. Some have no hormones, some have one type of hormone, some have both hormones as far as progesterone or more so progestin, which is the synthetic version plus estrogen. So we don't want to lump that all together. But oftentimes we will see excess yeast overgrowth because of excess birth control use or the wrong type or too many steroids. Steroids is probably the more common one, and then birth control for younger women. Also, poor oral hygiene leading to that systemic stress and inflammation. And then, by definition, if someone has used antibiotics more than once, so recurrently within the last 3 months, they're theoretically considered to be immunocompromised. And so, when your system is immunocompromised, your gut is immunocompromised. And when your gut is immunocompromised, you're more likely to get that overgrowth of candida, aka candidiasis. So that's what we need to address here. And so the symptoms that we're usually looking at, leaky gut, we talked about, allergies or food sensitivities. I'd put chemical sensitivities in there too, immune disturbance, weight gain or stubborn weight loss, headaches, brain fog, skin rashes, and fatigue. So you will receive a replay of this webinar, and so don't feel like you need to scribble this down as far as foods. And in fact, if you've been through this before, you have this list somewhere, either tucked away or something that we can send to you again if you need it. But what this is a side by side to help you understand what foods are okay during the yeast-free eating program in this regimen and which food should be eliminated. So this is part of our root cause approach. So this is the part that people seem to get the most overwhelmed by, and it's understandable because if we are not addressing the gut and we're not addressing the foods, then the body's really not going to be as responsive to the rest of the therapy, whether that's hormone therapy or whatever else it might be that your physician is recommending to you. That being said, those people who are already gluten-free or don't have high yeast foods in their diet, they're probably going to have the easiest time with this, but we still recommend it to all. And so most importantly, high level, the foods that are okay are going to be your meats. Just standalone grilled meat, prepared, nothing fancy, not a lot of ingredients mixed in the dish. Just keep it simple. Meats, eggs, salads, most vegetables are fine. What we're really trying to keep out are the foods that are high in yeast. We're trying to keep out the sugars. We're trying to keep out the sweeteners. And we're probably trying to keep out most of the condiments because of two reasons. Condiments oftentimes carry a lot of sugar in them. Actually, they oftentimes will carry gluten in them as well and preservatives, but they can be highly vinegar based as well. And so, since Candida is a yeast, it is part of and affiliated with the mold family. Mold has a high overlap with vinegars. So oftentimes people that have mold sensitivities, they don't do well when exposed to vinegar-based products, especially when they are ingesting them or even when they are smelling them or exposed to them in their environment. Additionally, foods that are prepared with vinegar or fermented foods, again, that fermentation process has a close overlap with yeasts and with molds, and so the body can't differentiate super well between what's going on there, which is why we ask for that elimination. Now, all these things that are being eliminated, they can be added back in. It's more important about the timeline. So the first 2 weeks is the most restrictive, and then the first month overall is fairly restrictive as far as whatever is currently in your diet. And most people will go through this usually about 3 months total. Some will go through the yeast-free eating program for 1 month with the medications and the foods. Some, depending on how they're feeling, their symptom resolution, or their doctor's approach in general, will take them to 3 months. So as far as what should be eliminated, we're talking about, again, the sugars, even some veggies you'll see in there that, so veggies and fruits also that are going to be higher in sugar content or have more of a simple carbohydrate profile, meaning that the body breaks them down super fast. And so if they get broken down in the body that fast, they get readily absorbed. It's too much of a sugar exposure too fast. So it's not like all vegetables are okay. Some you really want to limit or avoid. And then the others on here are fairly obvious as to why we're keeping them out. But something that is not so obvious to folks is we do also want to eliminate the products that feed the yeast. So even if the foods don't have yeast in them, we need to eliminate them out for said time that your physician requires, because if we're killing off the yeast by the use of these medications and by not putting more high yeast foods in, if we're still giving your body foods that feed the yeast, then it's kind of like a catch-22. You're not really going to make or get that much traction. And then you'll see my note here, after 1 month in moderation, the following may be reintroduced. So that's fruit, brown rice, sweet potato, oatmeal, for example, yogurt, and even liquor can be added back in. Usually we recommend that when you do start to add the liquor back in, choose ones that are highly distilled because those will be the cleanest. Vodka would be your best option. It's usually going to be multiple times distilled. So then we move into depleting the gut. So after yeast-free eating for 1 week, you have not started medications yet. somewhere between 5 days or a week. I like to just say 1 week because it makes it easy. So after eating yeast-free, like we talked about back here on this last slide for 1 week, then you're going to just start the depletion phase. So you're going to start depleting your body of the yeast, starting with localized treatment in the gut and the colon, which means that this nystatin, the compounded nystatin prescription that we compound and dispense at Physician's Preference Pharmacy, is helping to actively kill off the yeast that's present in the gut. Now, this is your standard dosing, 500,000 units. You don't necessarily need to know that, but what I have highlighted here is that our specific formulation is compounded without sugar, without dyes, and without parabens. So why is that important? If we are trying to kill off the yeast and rid your body of yeast, and yeast feeds on sugar, why would we keep sugar in the product? You're thinking, well, that sounds super obvious. Well, the commercially available product does contain sugar. And so that's why we actually compound ours free of sugars. We don't want dyes in there because that's just not helpful. And then no parabens. Parabens can be hormone disruptors as well. So, because most of our guests are on hormone therapy, we don't want to alter that. Now, again, nystatin is started first, and the treatment is localized just to the gut. So you're not getting absorption into the bloodstream from the compounded nystatin. These are capsules. We also actually do make it in an oral suspension, either if someone prefers it, or usually for the kiddos or for those that cannot swallow capsules, either due to age, being very young, very old, or to some sort of restriction that doesn't allow. But we recommend the capsules if the person can take it and is able. Now, a lot of instructions are going to come on the front of the bottle, but basically what this is saying here is that when you do start the medication, which is 1 week after you've started the dietary portion, you are going to take one capsule with each meal 3 times a day for 2 weeks. And then after that, you're going to bump it up. You're going to double that to 2 capsules 3 times a day with meals until the bottle is finished. This is the big bottle that you get usually on your first visit. Now, that big bottle is going to last you a little bit over a month. A common question we get is, well, what if I fast? So the question is, what is the intention for fasting? Is it weight loss? Is it to achieve cellular autophagy or detoxification? Is it something very, very strict that you and your physician have discussed, or is it more of a preference? Remember, the yeast-free eating program and this medication portion of this program is temporary. The max it's going to last is likely 3 months. So if you go 3 months with not perfectly keeping that fasting regimen, that's likely going to be okay. Of course, discuss that with your physician if it's physician-guided fasting, because there's probably a reason why they're having you do it. But that being said, most people tolerate the nystatin fine on an empty stomach. If you do need to take it, though, with a little bit of food in the morning, if that's when you're choosing to finish up your fast, then you can probably take it with something that's just a little amount of food if you need to coat the stomach. So everyone does it a little bit differently. Most people do just fine if they're taking it while they're fasting. Now, after you finish that first bottle of nystatin, then you're going to go right into 1 week of fluconazole. So fluconazole is not compounded. It goes also by the brand name diflucan. We also do sell it, but we don't compound it. It's just 7 tablets that you get. So after you finish the nystatin, then you take 7 days of fluconazole, because we have just undergone about a month of cleaning the gut from the yeast. But again, it's localized. We still need to address the yeast that may have leaked from the gut out into the bloodstream. And the reason we want to address that is because that will cause systemic issues and symptoms, but additionally, that is what can perpetuate food allergies or sensitivities. So we cannot ignore the bloodstream. We have to treat it too. So this is just a diagram kind of how we deplete the gut. So we start out with the yeast-free diet. We eliminate simple carbohydrates and follow the list that was on my 7th slide. And then that's during week 1. So during the full first month, again, the recap here, no yeast, no sugar, no milk products. I didn't discuss milk before, but the reason is dairy does feed the yeast, and so we like to pull that out. Alcohol, including fruit. Fruit is still sugar. Also, that's when you start the compounded nystatin capsules. Very important to also simultaneously start a probiotic. So your physician should be telling you that if you can get something that's over 4 billion colony forming units as well on a daily basis, that's ideal. And I always tell people, be sure to rotate your probiotic about every 3 months. Just like you rotate your foods, you need to be rotating your probiotics as well. That way you get exposure to different bacterial strains. Also, if you are a guest with us at the Hotze Health and Wellness Center, you will probably be getting something that is a buffer almost that you take along with the nystatin treatment. And if you do not get that, then you can use even something like baking soda and water or Alka-Seltzer Gold essentially to help buffer the acid that is created when you take nystatin. So what I mean by that is that when you take the compounded nystatin, that is an antifungal medication that is helping to perpetuate the die-off of yeast. When yeast dies off, it creates an acid. That acid builds up. Where does that acid build up? Usually in the joints, it can build up and that can cause some discomfort for folks. And so if we can help to neutralize that acid with some neutralizing capsules or NutriCaps, then we can help to mitigate some of those side effects that come. If you're starting on hormone therapy, oftentimes we will see that physicians will have you start your hormone therapy on day one of receiving those prescriptions and wait for a couple weeks before starting the yeast-free eating program. Because if you're brand new to all of this, if you do experience any side effects, we do not want you to misconstrue those symptoms or side effects of yeast die-off in the body for hormone side effects. Otherwise, what happens is that people choose to self discontinue their treatment. They're cherry picked based off of what they think is working for them, and now they're not being compliant with the full regimen. And so that doesn't paint a complete picture for us as pharmacists or your physician prescriber either. So that's why we stagger it in this way to keep any potential side effects identifiable for you so you know what's what. And then after that first month or you finish the nystatin bottle, then you go for the fluconazole. And most people we'll do what I call fluconazole sandwich. You're doing the nystatin, fluconazole, nystatin. So you're doing a bottle of nystatin, which is the big one, fluconazole for 1 week, and then nystatin again. So that would be for the course of 3 months. If your physician has you doing it just for 1 month, then it's going to look a little bit different than that. Okay, so I know that these lab results here are small, but the whole point is for me to show you that like with many things in our practice, we don't necessarily have to draw blood work to confirm that there is something going on, but we are still guided by the blood work. So we are largely guided by symptoms, which can be confirmed through the blood work. Now we see in two guests here back to back that the blood that was drawn before the yeast-free eating program and before nystatin was taken, the elevated numbers here show us that the Candida was elevated in the blood. Then after 60 days of the yeast-free eating program with our compounded nystatin, then they come back into normal range with Candida blood levels. Same thing here, 60 days apart. This is at baseline. You can see it all pops at red. And then after 60 days, we get back into the black zone or into normal range. All right. So another product that we offer that is a proprietary formulation at Physicians Preference Pharmacy is something called the antifungal nail solution. Now, the antifungal nail solution is comprised of a few different ingredients that can be used to help yeast die off that is showing itself in the nail beds, which is very common. So sometimes people will come in and they already have symptoms that are underlying in the nail bed. So they have either ridges or brittle nails, or their nails are crumbling, or they have those visible green streaks or visible lines around the end of the nail bed, which can indicate that there is some yeast overgrowth. However, when people also start the yeast-free eating program, it doesn't happen most of the time, but sometimes people will excrete that yeast out of the nail beds because the body needs to find a way to get that yeast to exit. And so everybody's going to be a little bit different. The way you detoxify will be different than the way I detoxify. And so the way that this topical nail solution is used is, as you can see here, this is actually a picture of ours, is it's just a lot like a nail polish. So it is applied directly to the top of the nail bed, and it's very important to get underneath that front part of the nail, which this is usually used on the toes, because that's how you're going to be able to penetrate the nail bed. Nail beds are very tough and they are very difficult to penetrate, so you have to find the best entry point. And just like any over-the-counter or prescription product that we're talking about for the nails, it's usually going to be a duration of about 4 months because, again, it's difficult to penetrate. We need to be sure it's making its way in, it's staying there, it's doing its job, and it's addressing any potential overgrowth. So, again, this is a proprietary formulation that we developed that contains itraconazole, terbinafine, tea tree, and also urea. There has been a lot of buzz around DMSO, which, if you've heard about that, you may know that it helps to drive ingredients into the skin. We've always had DMSO in this formulation, and that's exactly what it does. So, that's a very common ingredient to be added to compounded formulations to help them penetrate difficult to penetrate barriers throughout the body, in this case, the nail. Okay, so just wrapping up here with some notes on the yeast-free regimen. The duration, meaning the whole length of the treatment that you're undergoing for this, does depend on the severity of the yeast overgrowth in your body, aka the extent of those symptoms that are congruent with yeast overgrowth or candidiasis. So usually it's about 3 months, but it could be a minimum of 1 month, and then it's generally repeated annually. In a handful of cases, I have seen people repeat it a couple of times a year if they have really extensive overgrowth. So again, using sugar-free nystatin specifically is very important for overcoming candidiasis. The commercially available nystatin, so that you'll find at your retail drugstores, for example, they can and often do contain sugar, which is counterintuitive to eliminating the sugar and the yeast from the body, which is exactly what we're trying to do. So, this is a screenshot of a commercially available nystatin that I took about a week ago. This is the package insert, which is what the manufacturer includes with it that the patient gets when the pharmacist dispenses the prescription to the patient, has that little leaflet in it or that drug information sheet. And what it shows here is the strength. So it's the same strength that we make, 500,000 units of nystatin. This is made in tablets though, rather than the capsules. And so what we're concerned about, which is usually the case, are actually the inactive ingredients: cornstarch, confectioner sugar, there's yellow dye, red dye, blue dye, and polysorbate 80, talc. So just not a lot of stuff that we love in there, which is again why we make our preparation cleaner than that. And then lastly, we do finish up with talking about how we can replete the gut. So part of that is with probiotics. One of my favorites, which should not be taken simultaneously, but it's also good if someone is not ready to get started on the yeast-free eating program yet. Perhaps they can't afford it if they're not already enrolled in our program, for example, but they need to start somewhere, is they can use the probiotic called Saccharomyces boulardii. Saccharomyces boulardii actually itself is a yeast. So that's why we recommend not taking it simultaneously while you're on nystatin and fluconazole, because it is a beneficial yeast. However, if you take it, those antifungals are going to kill off that yeast because the yeast is a fungus. So it's something that can be used periodically throughout the year. Where I see this really work well, if someone is not constantly or not routinely on the yeast-free eating program, is with vaginal yeast overgrowth, and it works super well. Usually even just for 1 month, women do really well on it. So just a couple notes here, because if you've tuned in to these webinars before, then you know I do focus a lot on mast cell and mast cell overactivity. So I'm always very cognizant for my more sensitive individuals as well of what are the inactive ingredients that are present, not just in the medications, but probably more importantly, actually in the supplements, because that's usually where it gets missed. So what am I talking about? When we're talking about probiotics, probiotics are usually a blend of bacterial strains. Those bacterial strains are bacterial strains that are needed to replete the gut or keep the gut microbiome or the environment of the gut diverse so that it can help to fight off infection, it can promote digestion, it can promote mood, it can promote serotonin production, all those good things that are important for a good, healthy gut microbiome. There are certain strains that are not helpful to the mast cells. Mast cells are cells that are a type of immune cell, a type of white blood cell, and they're present in virtually every system of the body, which is why it's so important that we do our best not to aggravate them. There are certain strains that can be high, so bacterial strains that can be high in histamine or histamine releasing bacteria. You might also hear them called histamine liberators. So they encourage or promote the release of histamine throughout the body. Histamine is good until it's not. You've got to have histamine in your body and your bloodstream, but you don't want too much, right? So, classic example, we think about you get stung by a bee. What happens? You get a big welt. You take Benadryl, which is an antihistamine. It knocks it down, right? So, histamine's fine. It's trying to bring everything to that area to heal it, but you don't want the feeling of a bee sting for 6 hours, right? You want it for 30 seconds and then to be gone. So, being sure that we keep the histamine in check is important. So, why would we put bacterial strains in probiotics that may be bothersome to those people that one might be more sensitive or two should not be exposed to excess histamine? So many people might do fine, but again, this can be a commonly overlooked area. So just take an evaluation of what you're on. I've listed most of these strains for you here, but we want to use strains, bacterial strains that are supportive of the mast cells. One of my favorites that can help to actually reduce inflammation is Lactobacillus rhamnosus. So that is a really good one. And so keeping that in your rotation can be very good, but just keep note of some of those high histamine probiotics that are found in popular supplement brands. And here's a few of those right here. Okay. So just as a reminder, just like anything that comes from physician's preference pharmacy or any compounding pharmacy, it does require a prescription. So this is something you need to talk to your physician about. If they're not familiar with this approach or the yeast-free eating program and they haven't prescribed it before, you haven't done it before, then they can call the pharmacy or you can call the pharmacy and we're happy to walk you all through that as well. All right, so I'm going to stop sharing my screen now. And if anybody has any questions, I'm certainly happy to take them. Usually, what happens is we end up getting calls later on regarding the therapies or the cost or the approach or where to start. But most importantly, I want to thank you again for showing up here today. It doesn't look like we have any questions that are in the Q&A. So please feel free if you want to ask us questions individually or personally, you can always reach out to us at the pharmacy. I have listed the phone number here again. If you're not a current guest with us, you can reach us at Physician's Preference at 281-828-9088. And certainly we can help out with anything that you have, any questions that you might have about actually how to get started with it again. So we do have one question here just about if there's a replay. Yes. So for any of these webinars that you do sign up for, as long as you're registered, because we recognize not everybody can make it live, you will receive a replay. And we have another one that comes in here. So, has the yeast-free eating program or dietary portion changed much in the last 10 years? That's a good question. I've been on staff about 8 years and I really haven't seen many changes to it. So I would say probably not. The biggest thing that I think probably doesn't get talked enough about are some of the fermented foods, where there can be some I guess confusion is around pre and probiotics. So foods that tend to be rich in prebiotics can also be your fermented foods, and these are some of the foods that we want to stay away from. Also, some of the foods that are naturally fungi, right? So like mushrooms and things like that, we want to be sure that we're not ingesting those. But other than that, not too much has changed. So good question. All right, well, we have these webinars about every 6 weeks, so I look forward to seeing you guys at the next one. And if any questions come up, please feel free to give us a call. See you guys next time. Take care.